So the workshop upstairs was looking at gender and gender-based violence and considering sexuality, and how we could create an evidence-based and more inclusive strategies to be more inclusive, and also consider the language involved with that. And can I say, the group was amazing upstairs. The suggestions you came up with around each of the questions were so creative and obviously had so much context in your own work practices. Unfortunately, we didn't get much of a chance to discuss them as a whole group, but I'll go through some of the main themes. No, we didn't. Oh, no, it's okay. I'll just talk to it. So for the first question, were there anything at the moment that could address the issue in relation to gender and gendered violence, and what these things were and if there are any notable challenges? We looked at the respectful relationship programs at schools and how the teachers were being able to address LGBTI issues and the training that was required for the staff to do that. We had a woman from CASA talking about negotiating the input of gender and the consideration of power issues and gender dynamics when discussing consent and sexual assault with clients, I believe. Transgender Victoria talked about the films that they're going to present at a 2-day event, one for service providers and one for community members, and they're showcasing healthy relationships in the trans community, which will be potentially available online for people to access in the future, maybe. And we had one participant from Geelong who was looking at their community of practice and how that identified that Change the Story wasn't adequately addressing gender outside the binary, and so they organised a member from the Sexual Assault Family Violence Service in Barwon to come and talk about LGBTI issues to address that issue. So they were some of the strategies. There are a couple more issues that were identified in the workshop, but we'll go. The second question was looking at strategies and activities and how they could address the particular issue in this workshop. We identified policy audits, so to make sure that we were doing meaningful intersectional work and it wasn't just tokenistic. Looking at gender-neutral family violence policy leave, and then how to also address, determine whether or not people who were perpetrating family violence, were accessing that leave program. Upskilling and paying Aboriginal women to be involved in consultations. Upskilling staff in terms of being able to talk about LGBTI issues, meeting people where they're at and being able to nudge them forward in terms of talking about issues around inclusivity. And also questioning the other, so increasing organisational safety to reduce members of the LGBTI community advocating for themselves within the service. And the third question that we looked at, so what do we need to do to be able to address these issues, looking at interventions such as training and resources, a gathering space, research evidence, and specialist workers. So strategies that were identified looked at organisational change, so distributing staff surveys, to look at being able to increase the safety of employees or users about specific needs in the organisation. Acknowledging that our family violence space is rapidly changing and how to maintain and update resources, and also keep up to date with terminology that particular communities are using. What have we got there? Also focusing on looking at well-funded organisations, partnering or supporting smaller organisations, whether they're voluntary or not, to increase their capacity. And lastly, looking at staff and services doing their own internal critique around particular issues in relation to gendered violence in the LGBTI community, doing their own homework rather than immediately referring to experts from non-governmental voluntary organisations to pave the way for them. And our last question that we got up to was, how do we want to organise to undertake this work within our organisations? So we looked at large organisations being able to acknowledge their privilege and the position of funding and being able to redistribute resources to smaller organisations to assist with capacity development within the sector. Supporting smaller organisations by becoming members of those organisations. So when we're consistently referring to the smaller advocacy organisations to come in and do training or to speak to us, to actually support them and enhance their capacity by becoming members. Yep. So changing the reporting, changing how we report in relation to providing information to our funders about how we learn and the new kind of approaches and strategies we're using in this space, and to look more at sharing those learnings and that information within the sector itself. So rather than relying on our funding bodies to distribute our own learnings from our funded projects. And our last one was looking at the changing funding environment and seeking that our peak bodies look at the procure arrangements and do advocacy around the distribution of funds in the sector. So that's where we got up to in the workshop upstairs. I'll pass it over to Claire.
All right. So our workshop was looking at prevention of violence against women and prevention of family violence. I guess looking at how those different areas are potentially getting siloed, looking at where the commonalities are, where the differences are, and I guess having a conversation around really the general state of the world. We had really fantastic discussion in our workshop, and one of the things that each of our groups really talked about was, I guess, amidst all that conversation around what's in scope and where and what's a silo and what's not a silo, was reminding ourselves constantly that we are looking at that bigger system of inequality and that bigger system of violence, which all these forms of violence sit within. So, making sure that that is constantly part of what we're looking at in our work. Groups talked about, being really aware of pushing back on that siloing, of finding the commonalities, of speaking about the importance of us looking at people as complex full people rather than looking at just constantly working in silos. We had a really great conversation across each of our groups around, I guess, the history of our sectors. So the fact that, for a very long time, this work has happened in a very grassroots, radical space. But we are now at a space where we've had a Royal Commission, where we have, I guess, much more of a government mandate on what we're doing and much more, I guess, government control of what things are looking like. And that really changes how we work as a sector. So we had a lot of really interesting conversations around the fact that we need to do some reflection on what does this change mean for how we work as a sector? What does that mean for how we see ourselves and how we see our role, and potentially reimagining what that looks like given the current structures that we're in now and the future structures that we are potentially moving towards. So really good conversation around us, I guess, asking questions around, how do we stay radical in the current space? We had great conversations around how do we as a collective look to both, I guess, advocate for and protect the voices of the grassroots, of ensuring that we are continuing to put the voices of people who've been marginalised, continuing to put lived experience at the centre of this work. having conversations around who is and isn't at the table and why people aren't at the table, and advocating for who should be there. And we also, and someone talked about that being, some strategic centering stuff. And we also talked about the fact that we're in a space now where there's a lot of conversation around building the evidence and what it's going to look like to build the evidence. And I guess the role of us as a collective sector in terms of being able to say that we have a lot of evidence out there, that we have organisations who have been working in these spaces for many, many decades, who have their own evidence base that they've been building up, and making sure that we are really drawing from that grassroots expertise as part of creating what will become the evidence base and will be the formalised evidence base. And then we also talked about, I guess, sort of at a more close to home level, looking at continuing to find opportunities for both individual capacity building for us as practitioners, so us being really proactive in being able to say, this is an area that I don't know enough about and I'm going to learn about, but also organisational capacity building, because we know that we need to be working in enabling environments in order to support us and the kind of work we do with individual practitioners. So those were the key things that our group talked about. So what is going to happen now with all of those notes from the workshops, with everything that you wrote up, with everything that the note takers pulled together? GenVic are going to study those very comprehensively. They have been tasked with really being able to pull from that really valuable information some clear ideas around what are some of the next steps for this conversation. So that might be things that GenVic themselves are doing, or that might be things that they can say, this is a bigger project that needs to happen, this is a collective piece of work we need to do. But really hoping that we can take all of your expertise from these last 2 days and use that to keep this conversation going in many different forms. So that is a very exciting and ambitious bit of work that they get to do. Yes. Yeah. Indira says yes. With a woohoo. Yeah. All right, so we're coming into the very last bit of the day, and we will let you go very soon. But what we would like you to do before we finish up, and I know it is just a weary group out there because we've done so much thinking today and yesterday, but we want to finish, we'd like everyone to just think about a couple of things that you're going to take away from today, because as we said, sometimes when we're talking about this very big systemic problem, it can seem really insurmountable. We do want people to walk away with a couple of steps or actions that they think they're going to take. So as you'll see, there should be post-its on all of your tables, I believe. Most of the tables. There are post-its in the room to be found.
I've already put post-its out that I had. I don't know where the rest of them are.
Step one is to locate a post-it once you have found said post-it. So we want you to write down 3 things, and we will pop them up on the slides. The first thing is we want you to say, what's one thing that you are going to do after this conference to support your continuing development, whether that's professional or personal? What's one thing that you're going to do? What's one thing that you're going to take back to your organisation to do? And what's one key thing that you think that GenVic needs to do after this? But you can really focus on those first 2 because we have got a lot of ideas for the third one. But really think about one thing that you are going to do as an individual practitioner, one thing you're going to take back as a suggestion to your organisation or your workplace that they do. And then once you've written on those post-its and have a bit of a think about it, we've got some sheets at the very back of the room that you can pop it up on. So we're just going to take 5 or so minutes just to write that down. Okay. So I'm at the back of the room now. So feel free to face this way or face the front, and I'll just be a beautiful audio recording washing over you. We have some really, really great ideas, and I do encourage you on your way out, if you want to have a quick look, to get some other ideas about things people are planning on doing. Individually, people are looking at, they're going to do more advocacy. People are going to feed back to their teams. No, that's fine. they're going to look at how they frame violence against women, if they're going to start framing it as gender-based violence. People have said that they're going to review some of the content that they deliver in their training with an intersectional lens over it, and with a lens to some of the things that have been discussed over the last 2 days, looking at how their organisation can support smaller organisations. You know, someone said they're going to be looking at meeting people who are outside of their usual network, so expanding their networks. In terms of what people might want to do for their organisation. So looking at building capacity within their organisation, encouraging organisations to do intersectionality training, to meet with some of the organisations who we've had speaking at the panels today, people who are going to engage more with Respect Victoria, reviewing their own internal policies with a lens to how their workplace policies can, think more about inclusivity, think more about how they're practicing what they preach. Looking at bringing in pronouns within their organisation in order to be more inclusive, and using that as a starting point to then think about what else they could be doing. Inclusive language and representation, creating ways to build lived experience. Lots of really great ideas here. I haven't read them all out, but drop on by on your way out. And some really great ideas about what people would like GenVic to do. So looking at broadening the membership base, or reaching out for more people to be GenVic members. Somebody has said be brave, which is a really lovely encouragement. Jacinta. Looking to bring in more membership, expanding it beyond, its origin base of being the women's health sector, and looking at who else can come in and being members of GenVic. Being more radical, which is, I think, a fantastic suggestion. More forums, more opportunities, another Be Radical, more opportunities to have these conversations. Some really, really great ideas. And I guess what GenVic will look to be doing is taking on board ideas from here, taking on board ideas from the workshop and from across the last 2 days, and really sort of forming that into an action plan for what to do next. So, look, that really brings us to the end of this 2-day conference. Congratulations for still being here. It has been a busy 2 days. We have had lots of conversations. We have talked about so many things. People have contributed so much to this, and we know that this is a big thing to do right now in this very, very busy time, to take 1 day or 2 days out of the office to come and have these really important conversations. So thank you so much to everybody for being here the last 2 days. On behalf of GenVic, we would like to thank all the speakers and facilitators from the last 2 days. There have been a number of volunteers from Multicultural Centre for Women's Health and a number of other women's orgs who have volunteered their time to help out with various bits and pieces over the last 2 days, as note takers, all kinds of things, as correcting all the signage. So thank you so much to everybody. Thank you to everyone for being here today. If you haven't had a chance to fill in a permission form for the audio and the video, it would be great if you could do that on the way out. With that in mind, knowing that the last 2 days have been recorded, so that will be made available soon enough so you can revisit it, you can share it with people in your workplace, you can share it with partner organisations, whatever you would like to do with it. You can have a look to see if you appear in there and what you say, and if it sounds articulate, that is what I will probably not be doing because I'm too vain. Show of hands, who was here yesterday? Yeah, so that's too many people to use my pun about the forms again. But trust me, I made a pun about forms and I found it very amusing. But instead of giving you the pun, I would just suggest that on your way out, if you could do an evaluation form. And if you are not already a GenVic member and are interested in doing so, whether as an individual or as an organisation, the membership form is online, I believe. And look, swap numbers, take names, work out who you want to meet with in the future. There's a bar here. You can go to that bar and make use of it. And we really just encourage people to keep this conversation going past these 2 days, and know that you will hear from Gen Vic at some point once they've decompressed and pulled all the notes together with next steps. And if anything comes to you after this workshop, if you have a really great idea about what would be a really fantastic next step for this work, talk to Jacinta or Indira, let them know what those ideas might be. They're really keen to hear